Happy New Year, everyone. Thanks for joining us for CNTV. I'm Brad Clonch.
And I'm Quin Tran. Our top story, COVID-19 vaccinations are underway.
This is the start of the answer to our prayers.
Nearly 1,000 doses of the COVID-19 vaccines arrived to the Chickasaw Nation mid-December. They are the first of several more shipments of the Pfizer vaccines. The vaccines are handled and stored with great care. The first people to receive the vaccine are healthcare workers to help protect them from the illness as they continue to care for patients.
I'm hopeful we'll have plenty of vaccine, we think, by early spring, where we will be able to vaccinate pretty much anybody that shows up, on demand.
We connected with the first person to receive the vaccine at the Chickasaw Nation Medical Center. Rhonda Brown sees the vaccine as a light at the end of this pandemic tunnel.
Well, everybody keeps asking me, how do I feel? And I feel fine. I feel normal. The shot did not hurt at all. And my arm's not sore. So I think I'm really doing good.
Rhonda, tell us about the process, the vaccination process. Were you eager to be part of it?
Oh, yes. I was surprised that I got to be the first one to receive it here. And anyway, everything worked out great. The whole process was just like clockwork. She gave me the shot and it was over in no time. So I had to wait exactly 15 minutes before they'd let me go. I feel normal. I don't even feel like I've had a shot.
What are the next steps, Rhonda? I'm told that you will need a second dose.
Yes, it is like 21 days.
21 days when you go back for the second dose.
Yes. And then I guess I'll be good. I'll be good to go. But, I think everybody needs to know that you still have to wear your mask, even though you've had the shot. You still need the social distance. That part doesn't stop.
Rhonda, you are a Chickasaw citizen, a Chickasaw elder, and an employee with the Chickasaw Nation and healthcare worker. Healthcare workers are first to receive the vaccine. Do you feel a sense of optimism in this pandemic, knowing that this vaccine is here?
Oh, yes, definitely I do, especially for the elders, because they're hit the hardest with this. I really feel like maybe if I ever did get it, that would, and I'm diabetic too, so that plays a part in this, that it could be worse on me. Some of my elder friends have passed away, and I just think they could have been here. They could still be here if it hadn't been for COVID. I know I'm 66 years old, but I still want to keep working. And I'm not ready to retire yet. And I don't want to get sick. And so it's just to prevent it and let me keep on doing what I love to do here at the Chickasaw Nation Medical Center.
You've been a tribal employee since 1975, since 1988, a healthcare worker there at the Chickasaw Nation. You've seen so many transformations in your lifetime and in healthcare. How does this vaccine stand out?
Well, this is a first, that we've had to deal with something like this. And all these years that I've worked, we've never been faced with a pandemic. So this is a very first feeling that we get that this vaccine could help. So anyway, we need something. We need a turning point bad. And I think this will be it.
Is it amazing to you that this vaccine was developed so quickly and it's here now to help protect people and help save lives?
It's believable to us, maybe because we are medical laboratory scientists, The laboratory, I started in 1988 in the laboratory. And we mentioned that we didn't have computers then. And we had to handwrite a lot of our lab results and give them to the doctor. But those were the days. We've come a long way.
More vaccines are on the way in the months to come so that more people may receive it. What would you like people to know?
I just want them to know that the vaccine is a good thing, and that everyone should take the opportunity to take the shot. 2021 is going to be better. Everyone's going to be healthier, and the vaccine is going to help a lot of us be healthier and more optimistic, and not have to worry as much, about getting this virus.
Mrs. Rhonda Brown is just a few days away from getting the second dose of her vaccine. We'll continue to check in on her to make sure she's doing well.
The tribe has spent the past several weeks preparing for the vaccine.
Yeah, the Pfizer vaccine, it's a novel vaccine, just means it's new. It's nothing we've ever seen before. We've never had an mRNA vaccine. They've been studying this technology for decades, but they've used it mostly for like cancer treatments and different things like that. And when this virus hit, they already had the technology developed. They just hadn't put it towards viruses, towards vaccines. So very easy for them to ramp up that technology. But part of that came with storage requirements for the special mRNA vaccine that they developed. So the Pfizer vaccine has to be stored at minus 70 degrees Celsius. You have to have what's called an ultra cold or ultra low freezer in order to be able to reach those temperatures. And those are very hard to come by. We are very blessed in the Chickasaw Nation. We actually have 2 of them. We actually have a third that we're mostly moved into Ardmore to our southern clinic so that we could actually have a staging area down there for like our WinStar region and things like that. That's in our planning for in the future. But yeah, the vaccine has to be stored at minus 70. And it is good for the expiration date on that vaccine. Like the vials that we received this week, it says it's good till March 31st of 2021. So you got about 3 months to use it. Once you pull it out of that ultra cold temperature and put it in, like say, the refrigerator to thaw, you only have 5 days to get that vaccine used. And if we don't use it within 5 days, it will expire. Then once we actually thaw it out and are ready to dilute it, which is another thing that we have to do. We have to dilute this vaccine with normal saline. You have 6 hours to use it after that. So when we're at our events, we really are trying to work on the logistics of how many people do we know we have coming. We've got this many scheduled so that we end up not wasting a drop of vaccine. We don't want to waste any of it. We want to make sure we get it into as many people as we can. So we're always being diligent about that timeline of expiration dates and times.
Describe for us the moment that you received the vaccines.
So when we got the package from Pfizer and we were able to get it back to our warehouse, and I went to actually open it, it was just a sense of like, is this actually happening? Because you've been preparing for this for months, and it's finally here. And so I was just trying to remember everything that we've been, they trained us and what they wanted us to do. And so, you're nervous sitting there. It's like, I've opened boxes of vaccines thousands of times, but this is the first time I was actually nervous doing it a little bit because it's like, this is actually COVID vaccine that is surreal. But we opened the box and we turned off the monitor. It had a temperature monitor that tracked it from the plant in Michigan to us. So we knew how the temperatures had been the whole time. So it had never got out of range. I turned that off. And then I was able to unpack the dry ice. And then down underneath the dry ice was the actual compartment where the vaccine was stored. And I was able to pull that out. And then I had to actually cut it open. So I cut open the compartment with the vaccine. And there they are, 195 vials of vaccine, 975 doses, just frozen. It's amazing just seeing them all there. When we first saw it and were able to unload it and we knew it was coming, we had people physically break down in tears, Quin. I mean, that's how excited people were. And that's how much this means to people because we've been suffering since March. I don't think a lot of people that don't work in a healthcare setting understand the amount of suffering and just the hardships and trials that people that are dealing with it every day go through. So when we actually found out that we were getting it and it showed up, I had team members physically crying. They were so excited that it was here, and they knew that we finally had a chance to go on the attack. That we've been on the defense of this virus since March, and we haven't been able to do anything. But now we can go on the attack, and we can try to get it knocked out. So it's super exciting.
Travis Fries, the Director of Pharmacy Services at the Chickasaw Nation, will tell us more about the vaccine. In our next episode of CNTV, he explains how the vaccine works to protect people from the coronavirus. Now, for an update on a Chickasaw citizen who survived his battle with COVID-19.
Dr. Grant Lashley says each and every day for him is a blessing.
You gotta get independent to go home. So you gotta work on this stuff.
A few months ago, we told you about Dr. Grant Lashley. The Chickasaw citizen is an emergency room physician in Louisiana. He spent more than a month in the intensive care unit battling COVID-19. Dr. Lashley is on the road to recovery, one step at a time.
It's slowly, it's not rapid, but it's slowly making improvements. So overall, I think, things are still progressing, not as fast as I would like, but it's still progressing in a good way.
For those who are joining us and don't know your story, let me help by recapping a bit.
Sure.
Dr. Lashley, you are an emergency room doctor. You spent 39 days in the ICU battling COVID-19. At some point in that time, you suffered a stroke. And then when you got out of the ICU, you realized that you could not move, could not walk. And you've been spending the past several months in therapy, physical therapy, pretty intense therapy. It's been quite a challenge, trying to get back to life.
I go to physical therapy and occupational therapy. It's an hour of each, and I go 3 days a week. And when we're there, we work on just a realm of things. We work on strength training with weights. We work on balance. So we walk on all types of environments. We walk outside in the grass. We walk on pillows. We walk on all types of things, because if you're going to get back to really functioning, you can't just walk on straight, flat ground all the time. So we step over curbs, we step over blocks, we use a balance beam and figure out, if you're going to fall, how far would you go before you actually fall, but it's in a safe environment where you can stop yourself. So that's the physical therapy would be the big joints, the strengthening. And then with occupational therapy, the second hour of my therapy, we work on fine motor. We work on the hand, we work on getting some motion in the hand. We work on getting some flexion of my fingers, strength training with squeezing things. We spend our time trying to figure out and also with occupational therapy, their goal is to look at what things in your life do you need to acquire to go back to what you like to do. And so we look at things like, my big one was using a knife to cut meat. That was very challenging because my thumb wouldn't participate. And so that was one thing. Also, playing drums. I like to play drums. So that we've been looking at what we need to overcome to be able to go back to the things we like to do. And they like to find different type of exercises. Sometimes they're fun, sometimes they're painful. But minor things, buttons, zippers, functioning with these things. Beforehand you didn't even think about it. And now you really gotta think, if somebody dropped a penny, how would you go about getting that penny off the table with the hand that doesn't work so well? So it takes a lot of practice and repetition, strengthening, and once again, you've got to be there, and you got to be in the right mind to focus on improving, not on just what your deficits are.
And you're walking a little bit with a cane, a little bit without a cane.
My other new thing you didn't know yet, it's a big surprise. 2 days ago, they released me to start driving, which, yeah, I was thrilled. They're once again, I don't know if people know much about this, but different occupational therapy programs offer driving courses, and you have to do a lot of tests and have a letter for at least you'll be able to drive. And I did it before my wife knew about it, and and she came home one day, and when I'd been released, and she found a soda on my kitchen, or a drink on my kitchen table. She said, "Where'd this come from?" I was like, yeah, I gotta tell you something. But and the goal was not this. I'm not out there trying to drive a lot or hurt anyone, hurt myself. But I just want to know that if I had to, that I could do it safely. And so I did all the computer testing, and then they took me out with a like a driver's ed car with somebody that could take over if they had to, and everything went well. So you know, my kids are thrilled. You know, it makes you feel more normal to be able to do the things you need to do. And once again, one more step in the right direction.
Your family, your 3 children, your wife are your biggest cheerleaders. How have they played an important role in your recovery?
Well, it's multifactorial in that idea. You know, my wife is my biggest confidant, my biggest fan. You know, we speak medical to each other, so it's fun to be able to do it and keep your brain stimulated. You know, my children, you know, are always just energetic, and I'm glad that I'm functional enough to participate in their life, participate in their homework. I'm relearning second and third grade over again to help them. But so you know, if my children would tell you they are always looking for my shoes or looking for this, and my wife too. And the thing is this, all that's very nice, and I do appreciate it all. But there's a certain amount of recovery, they always have me telling this, that I've got to do for myself. And it's very nice to help people if they really need it. But sometimes you've got to let somebody in a recovery phase from an illness do some of the stuff themselves to achieve that confidence, you know, in how to function. You know, daily life functions are so important to all of us, but especially somebody who's gone through, you know, severe illness.
What have you learned about this virus as a patient, as a physician, and someone in recovery?
My family deals with this differently than others because of my situation. I think that, you know, obviously we're not rushing out to stores and rushing out to restaurants, and we're home a lot. And when we hear their big gatherings, we don't go. Face masks, personally, I believe that it does decrease our risks. You know, we're in the flu season right now, and other viruses. So right now, it's probably a good thing to be using, especially when you're in social areas, buildings, crowds, people you don't know very well. You know, in your home, I don't wear a mask, but when I'm out, I have a mask on. We go back to what the coronavirus is. It's a, you know, a respiratory driven virus. So it comes off from breathing, it comes off from coughing, comes off from singing, you know, clearing your throat. All these things will make the virus come out. It's not visible, you don't see it, but that's when it would be expressed. So just slowing it down at the face level with a mask, I think is a way we do slow this thing down. We need to do the things that are the easiest to help slow it for the population and for the people, especially people at high risk. You know, people with diabetes, chronic kidney disease, you know, other pulmonary problems. Now I will say, not everyone can wear masks. There are people with pulmonary problems. There are people with things that are not able to, and they have to do more social distancing than masks. But as a whole, most people that can should probably use masks whenever they can. I don't see any way around that right now.
What's your forecast on being able to get back to it and practice medicine? You're practicing medicine by giving me some advice here.
Right. Well, you know, as I told my therapist yesterday, you know, my brain's there, my body's catching up. So the forecast right now, we hope it's good. We still have some other tests to do. We're not sure right now, but as I see it, you know, I will be involved in medicine in some fashion. It may be different than before. I don't know when I could do long 12-hour shifts in an ER. Medicine has always been part of what I like to do. It's part of what I grew up watching my dad do. It's what I talk about at home with my wife. So I think that, you know, I don't know if I'll be involved in telemedicine like what you and I are doing. I've always had some interest in that. So I've got several things I'm looking at, but there's no definites yet. Right now, it's just getting the strength and the stamina to be able to last doing something.
Dr. Lashley, you have a big goal, and that goal is to be well enough to hike and see the Grand Canyon. How soon may we join you?
I love being outside. I love the Grand Canyon. By March of 2021, to hike the Grand Canyon, I've got my friends coming. I've got my therapist from Texas coming. You're welcome to come too if you're available. And once again, I was telling my wife, that's my goal. I told my neurologist is my goal. They think it's very reasonable. But I said, if I can't make it out, they'll have to bring me out on a donkey. But that's okay. It'll still be in the Grand Canyon. It'll still be a lot of fun. But that's going to be the goal. And once again, that's a lot of my motivation when I go to therapy. I know if I do 10 of one set, and if I can do 15, that's 5 steps closer to doing the canyon. And I think it's important for my kids to see a goal achieved. I think it's important that that mentally and emotionally that I have something to work towards. My children want to go do it. So once again, March, as long as we can travel by then with the coronavirus, that's where we'll be.
We are so happy that you're doing well, one day at a time, and those days are adding up to be very positive for you. Thanks so much for sharing with us, Dr. Lashley. We'll see you in March at the
Okay,
Canyon.
that'll be great. Come and we're going to cheer everybody on. My kids think it's going to be hard. I said, I've done it enough times. It is hard, but it's worth doing to see some of the great beauty out there that we can have in our country and in nature. So I think that will be a very momentous day. I mean, we got to think about on days that are hard or days that things aren't moving the way I'd like them to, I've got to keep remembering where I started. You know, I started with a ventilator tube in my throat and not being able to move, not being able to feed myself, not being able to even sit up on the side of the bed. So to get to this point that I can tell you that I'm going to walk the Grand Canyon and come out alive, it's a huge accomplishment. It's a huge victory for personally and as well as to represent what those of us that are out there like this have done.
We are so glad he's doing well. He's such a positive person.
We'll continue to follow his recovery and his quest to get to the Grand Canyon.
Our people are our stories.
In other news, the Chickasaw Heritage Series documentaries are airing in several cities across the country. Starting last month, the documentaries have been featured on public access television stations in California, Colorado, Texas, Minnesota, and Connecticut. In Minnesota, every Monday through mid-February, First Encounter and Bearer of the Morning will be shown. Bearer of the Morning is a 1-hour documentary that showcases the life of Teata, the famous Chickasaw storyteller. First Encounter explores the actions taken by Chickasaws in 1541 during their first contact with Europeans. The Chickasaw Nation offers these documentaries as part of an online curriculum for elementary and secondary school students. The public may also purchase the videos in DVD or Blu-ray format. For more information, visit chickasawfilms.com. They're a great learning resource for people of all ages. Well, we're so glad you connected with us for this edition of CNTV.
Thanks so much for spending time with us. Happy New Year. We'll see you next time.